If your child says no to wearing a pad, pulls off period underwear, says a product feels wrong, panics when you offer it, or says no every time you try to practice, this video's for you because saying no to a period product may be communication. It may mean the product hurts or feels too sticky, too bulky, tight, damp, noisy, or too smelly or unfamiliar. Or it may even be introduced too suddenly. So, before we decide a child's being difficult, we need to ask a better question. What is making this product difficult to use? So, stay with me because towards the end, I'll give you a simple product plan that helps you separate the real need, which is catching blood, from the specific product your child is saying no to. I'm CATH HAKANSON from Sex Ed Rescue. I'm a sex educator, nurse, parent, autistic ADHD, and I've been working in sexual health and sex education for over 30 years. So when I talk about autism, periods, and puberty, I'm bringing together lived experience, professional experience, parenting experience, and many years of helping families have clear, practical, shame free conversations about bodies, puberty, sex, relationships, and safety. I bring lived experience to this too, because as an autistic ADHDer, I know that something can look small from the outside and feel huge in the body. A seam, a smell, a sticky texture, a fabric change, a new routine, a product touching the body in a way that just doesn't feel right. Those things aren't small when your body is telling you it's too much. And that matters with period products because a pad, liner, period underwear, tampon, cup, or reusable product is not just an object. It's something your child has to wear, touch, manage, remove, put in the bin, wash, or trust while their blood is leaving their body. And that's a lot. So don't turn product use into a fight about doing what they're told. Find out what is making the product difficult to use. The goal is not to make your child use one specific pad. The goal is a blood catching plan that works for their body. Let's talk about why a child might say no to a period product. First, the product may feel physically uncomfortable. A pad might feel scratchy, sticky, sweaty, bulky, or just too long or wide. Wings might rub along the legs. The pad might move when your child walks. It might bunch up when they sit. The edge might touch the vulva or inner thighs in a way that feels unbearable. And period underwear can also be hard. It might feel thick, heavy, damp, tight, different from usual underwear. The seams, waistband, or absorbent section might sit in the wrong place. So when a child says, I hate it, that may be the most accurate language that they actually have. Second, there may be fear. Your child might not trust the product to catch the blood. They might worry that it will leak. They might be frightened of seeing blood on the product. They may think a pad means the bleeding will be worse. And they may feel worried because the product makes the period feel more real. So saying no is not always about texture. Sometimes it's about fear. Third, the product may change the routine. Autistic kids often rely on predictability. Usual underwear, usual clothing, bathroom routine, usual way the body feels. A period product changes that. Suddenly, there's a new item in the underwear, a new thing to check, a new rule for where used products go, a new step for the bathroom, and a new private body care routine. And that change can feel too big if it arrives all at once. Fourth, there may be too many options. Parents often want to be helpful, so they offer pads, period underwear, liners, different sizes, wipes, spare underwear, bags, apps, books, and choices. But too many choices can make your child feel more overwhelmed. They might say no to everything because the whole decision just feels too much. Choice is helpful when it's contained and not when it gives your child too much to sort through. Fifth, product pressure can make things worse. So if your child feels pushed, cornered, or forced, the period product can become linked with that distress. And the next time you offer it, their body may already be saying no. So forcing product use can make future use harder. Now, that doesn't mean blood management is optional. It just means that the support needs to change. We need to separate the need from the method. The need is this: blood needs to be caught, clothes need to be protected, and the body needs comfort and hygiene. Your child needs a plan, but that doesn't always mean you must use this exact pad right now. And if the product doesn't work for your child's body and sensory needs, then the plan needs adjusting. So, what can parents do? First, reduce the pressure. Instead of putting the product in front of your child and saying, you have to wear this, start with, we need a blood catching plan. Let's find the product that your body can manage. And that keeps the focus on solving the problem together. Second, test products outside period time. So don't wait until there's blood, pain, school pressure, or panic. Use clean products. Let your child look at them, touch them. Open the wrapper, notice the sound. Stick a pad into underwear and try period underwear at home. Wear a pad for a short time when there's no bleeding. And this gives your child a chance to learn the product without that urgency. Offer limited choices. Instead of saying which product, period product, do you want to try saying instead, do you want to try this soft pad or the period underwear? Or do you want to try it with wings or no wings? Do you want to practice now or after dinner? And that gives choice without making the decision too big. 4, try different shapes and sizes. Pads are not all the same. A shorter pad might feel better, a longer pad might feel safer. A soft cotton feel pad might be easier to manage than a plastic feeling one. No wings might reduce rubbing. Wings might help it to stay in place. And there's no universal best product. There's only the best starting product for this child now. 5th, consider period underwear. For some kids, period underwear is easier because there's no sticky pad. And for others, it feels worse because it might feel thicker or tighter. So don't assume it will solve everything. Test it at home without bleeding and for a short time first. 6th, practice with the underwear your child actually wears. Now look, this matters. If your child has preferred underwear, test products with that underwear first. A pad that works in one style may not work in another style of underwear. And if the underwear style that they prefer doesn't hold pads well, look for the closest possible alternative. Same softness, similar cut, similar waistband, but holds the pad better. And don't treat underwear as separate from product planning because they work together. And 7, use visual steps. Saying no to a product can increase when the routine feels unclear. A visual card might say, get pads, put in underwear, check the fit, wear, change when needed, wrap used product, bin or laundry, wash hands, ask for help if you need it. For period underwear, the steps may be different. Put on period underwear. Change if wet, uncomfortable, or full. Put the used pair in a wet bag or the laundry. Put on a clean pair. Wash hands. Ask for help. The routine needs to match the product. 8, look for the real barrier. Ask specific questions, but not too many at once. Is it scratchy, sticky, too big? Does it move? Does it smell? Feel wet? Does it make you worry about leaks? Is the sound of the wrapper uncomfortable? Is the bathroom part too hard? You can also offer pointing options if words are hard as well. So touch, smell, sound, size, wetness, fear, unsure. And this helps your child communicate the problem without having to explain everything. Now, this is a bit I promised you at the start of the video. Here's the simple product plan. Step 1, reduce pressure. We're not forcing this product. We're finding something that will help with catching period blood. Step 2, name the need. Period blood, it needs a product so it doesn't go onto the clothes. Step 3, identify the barrier. Is it touch, smell, sound, size, wetness, fear, routine change, or just too much choice? Step 4, offer 2 realistic options, not 10, but 2. And step 5, test outside period time. So before or when their period's not happening, get a clean product, short practice, and no urgency at all. And then step 6, use your child's real underwear and clothing. Check how the product feels when they sit, stand, walk, and move. And step 7, make the routine visible. Use simple steps for the product they can manage. And step 8, review and adjust. If it doesn't work, the plan changes. Your child's not the failure. The plan just needs more support. And here are some parent scripts you can use. Instead of saying, you have to wear this, try, we need to catch the period blood. Let's find the product your body can manage. So instead of saying, stop being difficult, try, saying no's often information. Something about this product isn't working. Instead of saying, it feels fine, try, it looks fine to me, but you're the one wearing it. Tell me what feels wrong. Instead of saying, well, this is what you chose, so you have to use it, try, you were willing to try it. Now we know it needs adjusting. So instead of saying you can't refuse everything, try saying, blood still needs a plan. This product's not the only option. Let's look at something else to try. Instead of telling them you need to get used to it, try saying, we can practice slowly and see what your body can cope with. And those words matter because they keep the focus on support and not on a battle. They also protect autonomy, and your child's body experience is not something to override. And at the same time, period care still needs a plan. Autonomy doesn't mean leaving your child unsupported. It means working with their body and needs to find the option that fits them best. So the takeaway is this. Saying no to a period product may be communication. It might mean the product hurts, feels wrong, smells bad, is too sticky or bulky or damp or unfamiliar. It creates worry, changes a routine, or was introduced too suddenly. So don't turn product use into a fight about doing what they're told. The goal is not to make your child use one specific pad. The goal is a blood-catching plan that works for their body. So reduce pressure, test products when they don't actually have their period, offer limited choice, and try different shapes and sizes. And consider period underwear. Wear a pad and period underwear together. Practice wearing the period underwear. Use visual steps. Separate we need to catch blood from you must use this exact product. And if the product doesn't work for your child's body and sensory needs, well, adjust the plan. Now, this is one of the reasons that I created Period Ready, because that's my first period course over in the sex ed shop, and it supports parents to explore products and routines before everything becomes urgent. It's designed for kids who are waiting for their first period, because you can test products and practice routines and build a plan before bleeding starts. It can also help kids who already have periods because how products feel, saying no to products, leaks, clothing, comfort, school plans, and routines can still need support after periods have started. And it also, Period Ready, supports both parents and kids with clear explanation so kids can understand, and it has practical scripts, checklists, and resources parents can use. So you can find it over in the sex ed shop along with other resources for talking about love, sex, relationships, and growing up. And remember, over at Sex Ed Rescue, that's where you'll find a lot of the blog content to help you with having these conversations with your child, even when the topic feels awkward, private, or hard to start. Now, this is the final video in my Autism and Periods series, So if this is the first video you've found, or you've only watched a few, this is a good time to go back through the whole series. Now, across this series, we've talked about preparation, sensory needs, blood feeling scary, literal language, predictability, body signals, school bathrooms. We've talked about privacy rules, worry before the first period, meltdowns and shutdowns, clothing comfort, hygiene, cleanup, detailed questions, the first period at school, and now saying no to period products. All of those pieces matter because supporting autistic kids with periods, it's not about expecting them to just cope with blood, products, change, school bathrooms, or private body care. It's about giving clear information, predictable plans, sensory aware options, dignity, autonomy, and support. And when we do that, periods can become less frightening, less confusing, and much more manageable.